Have you ever wondered why HbA1c is so often mentioned in conversations about diabetes management? Well, let's unravel this mystery together. HbA1c, also known as glycated hemoglobin, is a form of hemoglobin that's chemically linked to a sugar. The higher the level of glucose in the blood, the higher the level of HbA1c. This makes it a reliable marker for average blood sugar levels over the past 2 to 3 months. Hence its crucial role in diabetes management. Understanding HbA1c is akin to getting a broader view of your blood sugar levels, unlike a daily glucose test which provides just a snapshot. It's like comparing a panoramic view to a narrow window. This panoramic view is essential as it helps healthcare professionals make informed decisions about treatment adjustments, effectively personalizing your diabetes management plan. Understanding the role of HbA1c in diabetes management is the first step to effective control of this chronic disease. So, let's take this journey together, shall we? So, what exactly is the HbA1c test and how does it work? Let's delve a little deeper to unravel the mystery of this significant test. The HbA1c test, also known as the glycated hemoglobin test, is a simple blood test. It's not your everyday blood test, though. This test has a unique ability to provide a long-term view of your blood glucose levels, stretching back over the past 2 to 3 months. Now you might be wondering, how does it do that? Well, when glucose enters your bloodstream, it attaches to a part of the red blood cells called hemoglobin. The more glucose in your bloodstream, the more hemoglobin gets glycated or coated. This glycated hemoglobin is what the HbA1c test measures. But how does this give us a long-term view of blood glucose levels? Think of it this way: red blood cells have a lifespan of approximately 120 days. So by measuring the amount of glycated hemoglobin, the test can estimate the average blood glucose levels over the lifespan of these cells, which roughly equates to the past 2 to 3 months. So the HbA1c test is not just a snapshot of your blood glucose level at the moment of testing. It's more like a long exposure photograph that captures the fluctuations in your blood glucose levels over a lengthy period. This makes it a remarkably reliable tool to assess how well diabetes is being managed. It's important to note that the HbA1c test doesn't replace daily self-monitoring of blood glucose levels. Instead, it complements it by providing an overarching view of blood glucose control. It allows healthcare professionals to see patterns and make necessary adjustments to treatment plans, ultimately helping to prevent long-term complications associated with poorly controlled diabetes. As you can see, the HbA1c test is a crucial tool in monitoring blood glucose levels over time, which is vital in managing diabetes. Now that we understand the HbA1c test, the next question is, how often should it be done? The answer is, more often than you might think. For individuals who are managing diabetes, the recommended frequency of HbA1c testing is typically every 3 months. This may seem frequent, but it's crucial in maintaining a comprehensive overview of your blood glucose levels. Regular HbA1c testing is not just about numbers, it's about gaining insight into how lifestyle changes, diet, exercise, and medication are impacting your diabetes management. It's about seeing trends over time, not just isolated snapshots. It provides a long-term view of your glucose control, which is essential in minimizing the risk of diabetes-related complications. Remember, every person with diabetes is different, and the frequency of testing may vary based on your doctor's recommendation. But one thing remains constant. Regular HbA1c testing is key to keeping diabetes under control and preventing complications. In conclusion, HbA1c is not just a test, it's a pillar of diabetes management. This simple blood test, frequently performed in a healthcare setting, has profound implications for the health and well-being of individuals living with diabetes. By measuring the percentage of glycated hemoglobin in the blood, the HbA1c test provides an overview of average blood glucose levels over the past 2 to 3 months. This isn't a one-off snapshot, but a comprehensive picture, a reliable and consistent companion on the journey of diabetes management. It guides adjustments in medication, diet, and lifestyle, serving as a feedback mechanism for both the patient and healthcare providers. The HbA1c test is a beacon of hope for millions battling this chronic disease. It's our strongest ally in this fight, an invaluable tool for keeping diabetes under control and maintaining the quality of life. Remember, understanding and monitoring your HbA1c levels is a powerful weapon in the fight against diabetes.